what do you need to study for content? Okay, you need to focus on the most important category first. Which are the most important categories? All of them are important, but you need to start with the most important, which is number one, management of care. More than 20% of your exam is going to be about management of care, which of course includes delegation questions and prioritization questions. This is why I say without prioritization, without critical thinking, there's no passing the NCLEX. On top of management of care, safety and infection control. You need to focus, dedicate some time to study safety and infection control. And of course, pharmacology, maternity, and pediatrics. So this is the core, the most important. How do I know this? Well, I have been preparing students for over 8 years on passing the NCLEX. And I talk to them all the time, every week. We have 3-4 students taking the NCLEX, passing the NCLEX. And I talk to them, come on, tell me what happened. What did you see on the NCLEX? And these categories that I am mentioning to you are on all of the exams. So I repeat it again, safety and infection control, management of care, pharmacology, maternity, and pediatrics. That does not mean that the other categories are not important. Now, you need to divide your study time into effective study blocks. Well, what do you mean by that, Professor? What do you mean an effective study block? Yeah, you need to create a study block between 90 and 120 minute sessions, no more. And you need to take at least a 5-minute break in between sessions. It depends if you're studying full-time or if you're part-time, how many of these effective blocks you're going to have in a day. That's up to you. It depends on how much time you have to study. Now, this is key. This next step is key. You need to create a checklist. You need to create a daily checklist and prioritize NCLEX preparation during your day. And this is kind of a, let's say, an auto-evaluation technique. Because what do you think is going to happen if you go throughout the day and when you go to your daily checklist, you don't check anything for NCLEX preparation? And 1 day passes, 2 days passes, a week passes, you have done nothing for NCLEX preparation. Do you think you should be taking the NCLEX anytime soon? Probably not. This is important. Having a checklist is going to keep you organized, and it's going to give you like a track record of how much you're studying and if you're studying effectively or not. So this is key. If you really want to have a good opportunity to pass the NCLEX, you have to do this. Okay? Now, what else? What else do you need to do? And why do you need to do this? A structured plan will give you clarity, will reduce stress, and will increase your chances of passing the NCLEX successfully.